combination of both the exercises and the MaternaLIFT, the symptoms I was having disappeared and I was much more comfortable.
I've tried the pelvic belts and everything else, and all that it felt like it did was squeeze the area that was hurting, and it didn't really seem to offer any relief. I started wearing the MaternaLIFT suit, and for me that was absolutely incredible, and I really wish I'd found it earlier in the pregnancy.
I really feel more empowered now to tell women this isn't something you just have to live with. There's things that we can actually do to help you, or things to fix it. When I walked out of here, I was thinking, wow, it's that simple. I mean, it's kind of ridiculous that women suffer through so much discomfort and pain when really it's fairly easy to fix it.
I'm Kevin Hansen, obstetrics physical therapy specialist and developer of the MaternaLIFT Two-Step Home Program to relieve pregnancy-related back pain. This home program was originally developed for my own patients and consists of 2 action steps that work together to provide both instant and lasting relief of your pregnancy-related pain. The first step is a specific corrective exercise done to reset your upright pelvis. The second step is the added use of a new type of maternity support called MaternaLIFT to help support your upright pelvis as you function throughout the day. Before we learn about the underlying cause of pregnancy-related pain and why supporting the upright pelvis is your key to effective relief, let's begin by visiting with a few of my patients to hear the stories of their pregnancies, stories that tell of the pain they've experienced, and their stories of success in using this 2-step home program to get relief.
My name is Amy and I'm a teacher. I'm currently 34 weeks pregnant with my second child. During my first pregnancy, around 20 weeks, I started experiencing discomfort in my hips, especially at night when I was trying to sleep. When I saw my OBGYN, he referred me to Kevin Hansen, a physical therapist. And when I saw Kevin, he noticed that I had stress on my pelvis due to the pregnancy and recommended corrective exercises. At first, I was a little skeptical that exercises would be enough to help my problem with my hips. But after a couple weeks, I noticed great relief, and they were easy to do. I could do it twice a day, and it solved my problems. When I got pregnant the second time and started experiencing the same symptoms, again around 20 weeks, I came back to see Kevin Hansen and just thought I'd get a refresher on those exercises and that would be enough. But I noticed a couple weeks into it that I still wasn't experiencing the relief that I had the first time around. At that point, Kevin recommended the MaternaLIFT, and I thought, well, I will give it a try. And when I tried it, I was surprised that with the combination of both the exercises and the MaternaLIFT, that the symptoms I was having disappeared and I was much more comfortable.
I'm a certified nurse midwife and a women's health nurse practitioner, and I work in the area. So this is my third pregnancy, and I obviously see a lot of pregnant women during the day, and I work full clinic days, and I'm on call and I deliver babies. So I mainly see women for prenatal care, but I also do full scope women's health practice. I hear a lot about pelvic pain, back pain during pregnancy, and having experienced it myself, I can empathize with women, how disturbing it is to your daily life. Pregnancy, although it's a wonderful thing, is really difficult. It's hard. You know, whether it's sleeping or nausea, or, you know, it's one thing or it's something else. But I feel like back pain is one of those things that I hear a lot about. When I was pregnant with my second baby, I got to the point where I could barely walk, and just because of my pubic bone pain and my back pain, and it was horrible. And that was one of my hesitations with thinking about having another baby, because I just thought, I can't do that again. It was horrific. So once I started having those same sort of feelings and the pain was starting to come back with this pregnancy, I made the lovely decision to come see Kevin, kind of preventatively. And you just went over the exercise with me that basically just changed everything. I mean, it's allowing me to work longer. I feel better. I feel more like myself. I'm not moaning all the time when I'm changing position. I can sleep better. It's impacted everything. So I really feel more empowered now to tell women this isn't something you just have to live with. There's things that we can actually do to help you, or things to fix it. I feel like coming in to you and learning the exercise has made a huge difference.
Could you talk a little bit about your trial with the MaternaLIFT?
Yeah, so I wore it a couple, 5 days ago, and I worked 16 hours and I was on my feet pretty much the whole time, and I felt really good. I mean, at the end of the day, it was just normal pregnancy stuff. My feet hurt, I was tired, that kind of thing, but my pelvis felt great, and that night I slept really well, which usually after being on my feet that long, I'd be kind of achy and sore and would expect to not sleep very well. And then the great thing was the next day I felt just as good, and I actually took a day off from the MaternaLIFT. So I think it obviously held everything together and tilted my pelvis in a way where I was able to walk around all day, get my job done, see my patients, take care of my kids when I got home, and just kind of live my normal life.
Despite the differences in each of their circumstances and symptoms, there are two main points that apply to these women, to most women experiencing pregnancy-related discomfort, and likely to you. The first point is that the same fundamental pregnancy-related stress, the forward rotation of the pelvis, was the underlying cause of their discomfort. Can you feel how your pelvis rocks forward and downward in response to your baby's growing weight? Allow your pelvis to rock farther forward. Notice how this movement increases the stress on your low back, pelvis, hips, and legs. This forward rotation of your pelvis is the underlying cause of most pregnancy-related pain. The second point is that by focusing on resetting and supporting their upright pelvis, they were able to get sustained relief of their pregnancy-related pain. Try rocking your pelvis backwards. Do you feel a sense of relief as your belly is lifted up, the curve in your low back flattens, and your tailbone is tucked underneath you? By addressing this fundamental stress using the MaternaLIFT Two-Step Home Program, Amy, Laura, and Amber were able to get sustained relief of their discomfort and despite their varied symptoms. Let's look at step 1 of the home program, the corrective exercise done to help reset your upright pelvis. Remember, discontinue the exercise immediately if it is uncomfortable to do. We recommend that you do this exercise at least twice daily, once in the morning as you start your day, and again in the evening, just prior to going to bed. To create a slight incline for the exercise, I use 4 pillows, and I'm just going to line them up like this. I'll stack them 1, 2, 3, and then I put the 4th pillow on top, and that gives us a nice angle for Laura for the exercise. How about, Laura, if we have you sit up on the edge of the table here? Sure. And then just with the good body mechanics, why don't I have you actually start by just facing towards me? So we'll do that. Yeah, there you go. Let's have you rotate, go down on your side first. There you go, and then rotate side to back. Okay, and I'm going to purposely scoot you pretty close to this edge of the table. Okay. Okay. Are you comfortable? Mm-hmm. Okay, so this is the corrective exercise, and one point I really want to make at the beginning of this is you absolutely stay within your own comfort tolerance when you do this. So if you start getting into any angles that do not feel comfortable to you, you stop the exercise immediately. So it is absolutely done gently and within your own comfort tolerance. Okay, so let's start, Laura, and what we'll do here is we're just going to bring that right leg up in a straight line. We've got the leg at about 45 degrees. You notice my hand position. I'm under the leg, and I'm actually just on this side of the ankle. This is really important, Laura. You need to really have your leg completely relaxed to do this. So you tell me when you feel like you've let the weight of your leg really just drop into my hand. Okay. Okay? This is with a very light, gentle grip with my hands, and this is a very gentle pull. All I'm going to do is very lightly bring the leg out in a straight line as if I'm lengthening it a bit. Okay, and then I'm going to do a slow count to 5 while I am lightly stretching it. 1, 2, 3, 4, 5. Okay, so that's the first part of the stretch. Now you let that knee bend. You're going to just now steer the knee just wide of the belly, and that brings the foot in a little bit, so it's kind of just a natural angle here. Laura can do this part of the stretch completely by herself. And what I'm going to have you do, Laura, is if you can come in with your right hand on your right leg here, I'm going to say about right here. I just want to point out a few angles. It works best if you do keep the knee at 90 degrees. So in a sense, you don't want to bring your leg this way. What we're really trying to do is we're trying to stretch the knee towards the bed surface, so try to stay at 90 degrees. And what you're going to do is you're just looking for either the beginning of resistance or any sense of discomfort, you would stop, okay? So very gently bring your leg in this direction. Tell me when you feel like you're starting to run into a little bit of resistance. And then once you feel like you've hit that light resistance, you're just going to very gently counter push with the leg now, Laura. So coming up. 1, and why don't you count out loud?
1, 2, 3, 4, 5.
Okay, and then you let the leg completely relax. Once you're relaxed, now you're just going to gently stretch again until you feel like you run into a little bit of light resistance. And you see how the knee was able to get a little farther back. What you're doing really is you're getting that really nice posterior rotation on your pelvis. You're reversing the pressure that was created by the baby's weight in your belly. Okay, very gently counter push again.
1, 2, 3, 4, 5.
And relax. And then again, that light stretch going down. Okay, and then one more time.
1, 2, 3, 4, 5.
Okay, and give it one more good stretch. Good. And then we're going to let this leg rock all the way back. Okay, after you do one side, and you can start on either side. If you do have discomfort that's more focused on one side than the other, I recommend you start on that side. And then you just come around the other side of the body. Everything is the same. You go through the gentle elongation stretch, and then the rocking back. When you do the left leg, you use the left hand. And after you stretch both sides, you're going to do this light bridge, and let's go ahead and do that, Laura. Okay, so you do want to start for this. You want to make sure your knees are kind of squared up nicely over your hips. How about with your hands, if you can go on the skin of your belly and just very gently feel like you're moving your skin towards the middle of your stomach. You want to hold that. You do a nice pelvic tilt, and this is this angle with the pelvic bones where you're going to rock the pelvic bones back to flatten the curve in your back. Hold that angle. Gently in your mind now, you're going to draw your belly button deep into your body, and that tightens the abdominal core. And then picture in your mind if you had to cut off the flow of urine, you're going to lightly tighten the pelvic floor. Now you're going to just hold that tight, but just come up just enough with the tailbone now so that the buttock's off the ground. And then do a count to 5 out loud.
1, 2, 3, 4, 5.
Okay, and try to maintain your tilt. Come down slowly, and then when that tailbone's all the way down, you just rock up and out of it. Okay? And in general, I like to just say, ideally, to do maybe 3 sets. So you do each side and then a bridge, that would be 1 set, and then repeat that 2 more times. To increase your chance of getting sustained relief following the execution of your corrective exercise pattern, Step 2 involves the use of a new type of maternity support garment called MaternaLIFT, the result of a collaborative effort between women's fashion designer Jessica St. Marie and myself, and worn under your clothing as you function throughout the day. MaternaLIFT was designed specifically to support the upright pelvis.
I started wearing the MaternaLIFT suit, and for me that was absolutely incredible, and I really wish I found it earlier in the pregnancy. And it's been really great because it does feel like it stabilizes my body, and it keeps that looseness in line, and it makes it so that it feels like I'm not going to fall through my legs and that I can still walk. So for me that's been really great, and I wish that I had actually found that earlier on in the pregnancy for sure.
It's common in pregnancy that the pelvic joints can be destabilized to the point where the pelvis is incapable of maintaining its upright position as you function throughout the day. The cause of this pelvic instability can involve many factors, including how loose your muscles and ligaments get in response to the pregnancy hormones, the size of your baby, how many babies you've had, your body shape and present fitness levels, as well as your daily activity requirements. The bottom line is that if your discomfort returns after doing your exercise, your pelvis has likely been destabilized and is unable to maintain its upright position as you function throughout the day. In this case, adding the use of a MaternaLIFT support can help you get sustained relief. Prior to MaternaLIFT, our experience was that the maternity supports available on the market were not particularly effective in supporting the upright pelvis. Like Amber and Laura, most of my patients who tried these traditional maternity supports reported that they were uncomfortable to wear, especially when sitting, and did not provide much relief. Not surprisingly, when I would recheck their pelvic position, I would find that the pelvis was returning to its forward stress position, and despite the added use of support. MaternaLIFT was an invention of necessity. Our goal from the beginning was to develop a new type of maternity support that was effective in supporting the upright pelvis and comfortable to wear throughout the day. After multiple prototypes and the feedback and assistance of several of my patients, Jessica and I created an innovative design that is comfortable to wear, supports the upright pelvis, provides relief throughout the day. The bodysuit allows us to start these anchors higher up on the back, and what this does is this allows the straps to come down from a higher spot. You notice we're anchoring above the hip, and with the combination of the strap coming down from a steeper angle around the back and coming down vertically, what the support is doing is it's actually helps supporting that pelvis rotating back up and into its upright position, and that is the stable position for the body, the low stress position on the low back, the tailbone, the pubic bone in the front, the hips, and the legs. And then let me rotate you to the back this way, Laura, just so you can see the straps as they crisscross the back. So you can see the straps crisscross from both sides and attach above the hips. And again, the function of this strap is to help tip and rotate that pelvis back, flatten the curve in the back. You feel like it's giving you a pelvic tilt?
Yeah. After getting it on, it's offering a little bit of support to the belly, which feels nice. So it's kind of like one of those maternity support bands, but without all the Velcro, which is actually, it feels better. It's really stretchy. My initial thought with the MaternaLIFT was that it was going to be really hot. And although it is kind of a big garment, it actually breathes really well, and it's pretty comfortable to wear. I also feel some nice support in my lower back, and it helps. I can already feel it just helping to tilt my pelvis.
And back, tilt your pelvis where?
It's tilting it a little bit more up.
Okay. MaternaLIFT strap system is such a breakthrough in supporting the upright pelvis and providing relief that a patent was granted for its innovative design. The material over the belly and chest areas has the highest level of stretch capability, allowing the support to remain comfortable as your body expands with the developing pregnancy. With the open crotch design, your underwear is worn over the garment, allowing for easy restroom use. MaternaLIFT is made of nylon and spandex, giving the support its lightweight and breathable feel. And there are no straps focused over the hypersensitive underbelly zone, allowing you to wear your MaternaLIFT comfortably throughout the day while sitting, standing, or bending.
I like that it's really stretchy, it's soft. I can see that it works for my pregnancy right now, starting to use it at 5 months, and I can see how it's going to work all the way through the end. It's not something that fits me for that period of time, and then I need to buy the next size up and the next size up as my stomach grows larger. So I had done some of my own research online and looked at other garments and even read reviews from other women, and nothing just felt like it was going to be the right garment, supportive enough, or the right fit. It seemed large at first, and then definitely the fact that it's designed so that you can function throughout your day, to be able to use the restroom whenever you need to and not have to take it off, almost like you would with a one-piece bathing suit. To see the crotchless design was a little bit alarming at first, but within a day of wearing it, you completely understand why it's designed that way, and you're thankful that it functions in that way. You choose when you want to wear it. You choose the days that you know you're going to be more active and that you need to have it on. Also knowing that after taking it off a day or two, or even for a week, you're still having the effects of wearing it on that really busy, hectic, crazy day.
I'm on my feet a lot as a teacher, and I actually appreciated the support a lot. And so even though it looks a little strange at first, when I tried it on, and now it's comfortable, it's a part of what I wear, and I don't notice it.
Are you wearing it right now?
I am, yes. I definitely would recommend this to other women. The MaternaLIFT has really helped take away the pain in my hips and has really made my pregnancy a lot more comfortable.
I absolutely definitely would recommend it. I really would. I was thinking, whew, that's kind of an intense looking contraption. And I've seen some things online, you know, with like all these straps and buckles, and they just look super complicated, and you just sort of wonder, are these things actually going to work, or is it going to help? The MaternaLIFT actually, it's not complicated, it's sort of a big thing. And my thought after that was, I'm constantly overheating all the time being pregnant, and I was concerned about that. I thought, oh my gosh, I can't possibly wear this. I'm gonna sweat all day if I'm wearing this thing, especially moving around as much as I do. Actually, it wasn't nearly what I thought it was gonna be. So it's really easy to get on. It's really easy to hook up. There's only, 4 little snaps or buckle things. It wasn't as hot as I thought it was going to be. It was great, and it worked. So I feel like it's worth it. I mean, to be able to live your life and do things that you would normally do, and not have your pregnancy impact you in a way that you can't accomplish the things that you want to do during a given day, you know, within reason. I think it's great. It works. I mean, I see a lot of women that are working moms, and they want to work, or they have to work up until the end, and they're miserable, or they're just wondering, I don't know how I'm going to do this, especially if those women that are having pain at like 26 weeks. I mean, they've got a ways left to go. So I absolutely, definitely would recommend it.
Consult with your healthcare practitioner prior to initiating the two-step home program, and provide them with a link to this video presentation for their review. Start with the corrective exercise done each morning and evening. Add the use of the MaternaLIFT support to maximize the results of your corrective exercise and sustain your relief as you function throughout the day. You have the information you need to help relieve your pregnancy-related pain. Now it's up to you to take action and put these steps to work for you. If you are interested in ordering a MaternaLIFT support or would like more information, go to our website at www.maternalift.com. If you would like to talk directly with us, our contact number is 855-682-5438. Also, we can be reached by email at support@maternalift.com. We would love to hear from you and about your story and experience with the MaternaLIFT Two-Step Home Program.